A lot of our food as medicine programming is really looking at, the challenges or the barriers that our patients are experiencing, that the community members we serve are experiencing, and how can we offer fresh food distribution in ways that deepen the impact and really match the needs that they have.
Fairview's Food is Medicine initiative, Fair Table, is serving food and serving our patients and the community. It's an enormous challenge, but Fairview has a long history of doing this work.
Food is one of those amazing ways that people can come together and break bread, right? And so being able to use food as medicine as not just nourishment and good healthy food getting to people who need it, but a way to connect with patients and community members.
We are standing here on the Hoffa Farm, which is a 155-acre farm that provides long-term land access for many Hmong farmers whose livelihood derive from their farming background.
This sprawling farmland in Vermilion produces over 120 kinds of fruits, vegetables, and flowers.
This is actually very typical of a Hmong farmer experience, right? It's not just the parents doing it, it's not just the kids doing it, it is actually multiple generations.
On this day, a celebration of the work that happens within Food is Medicine, program participants bust from the city to share in a day of fun fall activities with the farmers themselves.
It has been wonderful working with Fairview. That's one of the benefits of this and one of the compelling stories about wow, food does really connect us all and it makes us full, right? Not just full in our stomach, but full in our hearts.
I love this day in particular, being able to connect the patients that are eating this food every day now as a part of their care plan with the farmers who are growing it and with this special farm. I mean, it is pretty amazing.
Prior to this program, right, it was the noodles and the hot dogs, right? Trying to just make ends meet, making goulashes out of whatever I got in the cupboard, right? But I will say when it came to these boxes coming on a weekly basis, it was something to really look forward to.
When you can offer this type of service to a patient or a family that's struggling with food insecurity, the stress that puts across that patient and across that family is huge. And so to be able to have a concrete way to lift that stress is just transformative. And then the second piece is their physical health. I mean, once people start eating healthier, you start to see the improvement in things like their blood pressure, their diabetes control, and the long-term stuff that we know, the science shows us, reduced risk of colon cancer, reduced risk of cardiovascular disease.
Food prescription programs are just one of the ways Fairview and their partners are bridging the gaps around food insecurity and nutrition-related health conditions.
We try to have, a menu of options that really can fit for a variety of situations, a variety of conditions, a variety of, populations or demographic groups. Talk about what additional barriers they're experiencing. Is your food insecurity stemming from income, from transportation, from time, mobility and health, accessibility, and which programs would be the best fit for you. So we've been able to invest in these positions to really build relationships with patients that are experiencing food insecurity and connect them to the programs that would be the most appropriate for them.